Hi, everyone. Welcome to the Perfect Dose podcast. I'm your host, Dr. Kristen Herzog, board certified nurse practitioner and injection specialist. This podcast is all about helping you navigate your aesthetic treatments. We dive deep into all things, including injectables, treatment plans. We talk skincare tips, wellness tips to help you navigate your beauty journey. On today's episode, I am so excited to dive deep into weight loss and how this changes your face. Everybody seems to be on Ozempic right now, and especially during the holidays. I don't know about you guys, but I am all about shedding those extra pounds after eating all of the turkey that I ate on Thanksgiving. So I get a lot of questions in my practice about how weight loss can impact your face. What changes can you expect? Should you wait till you lose weight in order to get injectable treatments? Are there treatments that can help maintain skin elasticity as you lose weight? So all of these questions we are going to break down and get into the nitty-gritty on today's episode. Before we really get into a deep dive of what aesthetic treatments are appropriate on today's episode, I want to talk about how weight loss actually impacts your face, because when we lose weight, you will see changes in your face over time. And this is very important to understand, especially if you are on Ozempic and you are experiencing rapid weight loss. The faster that we lose weight, the faster that we're going to see these changes in our skin and on our face. So let's talk about this. What happens as we lose weight, and this really correlates with what happens as we age, because as we age, we lose our fat pads. We lose our deep fat, and our deep fat keeps us looking young and refreshed. And we also have a descension. So descension means like to come down of our superficial fat pads. So what that means is things start to sag and fall as we lose fat with age. So the same thing happens with weight loss. We lose our fat. And fat is such a funny concept because you're like, oh my gosh, I don't want to look like a fat round face with filler. I want my face to look really snatched and contoured and skinny. And I hear this all of the time in my treatment room. And the reality is that fat in our face actually keeps us looking young. And I don't know if you guys remember when Adele lost a ton of weight, but the first time that she lost a ton of weight, everybody was like, oh my gosh, she looks scary. She looks hollow. What's happening to her? And it's because the fat in her face was keeping her looking youthful and refreshed. So she looked a little scary for a little bit. Then she went and got some fillers, maybe some plastic surgery, who knows? And now she looks freaking next level amazing. But those treatments were focused on replacing that volume that was lost because of weight loss, and not in a way that looked unnatural and weird, but in a way that really suited her, in a way that made her look natural and refreshed. So it's just important to understand that fat in our face is actually youthful. So that's one of the most important things to understand when you're losing weight is you're going to see changes in your face. And unfortunately, most of the time, we're actually going to see these changes in our face before we see the changes in our body. It is like the most annoying thing ever, but I'm telling you guys, when I start losing weight, and I'm talking like 5 pounds, not even a lot of weight, I can see it in my face. My face literally looks different. It takes a lot longer to notice the fat changes in my body, unfortunately, but I do see it in my face. So when it comes to weight loss, we need to understand we're losing fat in our face. The next thing to understand is with this rapid weight loss, we're actually going to see some changes in our skin elasticity. And for those of you listening, what does skin elasticity mean? Well, skin elasticity is like how bouncy and how supple our skin feels. And what happens is as we age, just in general, we start to go on this decline of collagen production. And collagen is the protein in our bodies that make our skin firm, bouncy, tight, and elastic. So if we are losing collagen already, then you throw weight loss on top of that, you're going to see an even faster change in your skin elasticity. So people that have extreme weight loss may be like, well, my skin feels loose. Just like in our bodies, the same thing is happening to our face. If you have dramatic weight loss in your body and you're losing fat and you don't do anything for skin tightening, you will have loose, sagging skin. That is just the reality. So those are the two ways that losing weight is going to impact your face and your body. And we are in our era of treat to complete natural aesthetics. So I'm going to talk about face and body because both are equally important. So if you're losing fat and you're going to see some hollowing in your face, Particularly, you're going to notice it in areas like this preauricular space. It's the area by your ear and underneath your cheek. That area will start to get hollow. And I know some of you are thinking, well, this is making me think of a buccal fat pad removal. And yes, this is why I never recommend buccal fat pad removals, because we need fat in our face to keep us young. And as we age, we're going to lose that fat anyways. So if you get this procedure, in my opinion, it's going to make you look more aged faster over time, because we're going to lose weight and we're going to lose our fat in this area. And with weight loss, we're going to notice it there. We're also going to notice our fat changes in our face underneath our eyes. So it's called the anterior medial cheek fat pad, and it's literally just the space from the bottom of your nose to the top of your cheekbone underneath your eye. So like right where your tear trough is down to the bottom of your nose. This is the area that you will notice some flattening. You will feel like you look more tired. This is a symptom of losing fat in this area, and that fat keeps our face looking young and refreshed. So what about skin elasticity? Well, what we'll notice is our skin will look looser. Our skin won't look as tight. So maybe you're listening and you're like, yeah, I know exactly what you're talking about. I lost a bunch of weight and I felt like the skin around my jawline was just not as tight. It felt a little bit looser. So these are the things that you're going to experience. And again, it's the same thing in our bodies. So same thing that happens in our bodies when we lose weight is going to happen on our face. We're just going to see it faster because we have less fat in our face. It's a smaller area. So it makes sense as to why we would notice these changes quicker than we're going to notice on our bodies. So now that we understand what's happening with weight loss to our face and our bodies, we're going to get into what treatments I recommend, because I'm telling you guys, it is like my most popular asked question in clinic. It is, should I wait to lose weight before I get fillers? Are fillers going to dissolve and break down faster if I'm losing weight? And I want to help you guys make the best aesthetic decisions for you. So when it comes to fillers and different treatments for your face, fillers are a hyaluronic acid gel. And I did a podcast about this earlier. I talked all about fillers, what they are, and how to decide between fillers and collagen stimulators. But fillers are going to add volume back, and they are a gel. So you're going to get immediate results, which is really, really great. But if you are losing a dramatic amount of weight, I always recommend to my patients, fillers are not the best treatment option for you because your face is going to change relatively quickly. And because we are going to metabolize fillers over time, the faster we lose weight, we're going to lose this volume even faster. So you may not hold on to your results. So my rule of thumb is when it comes to dermal fillers, I recommend being within 25 pounds of your weight loss goal before getting dermal fillers. And this is because your face is going to continue to change. And if you're losing 50 or more pounds, you're going to see a significant change in your face. So I'm always going to recommend not doing dermal fillers until you get into that sweet spot of 25 pounds or less. That is when I will recommend doing dermal fillers. Now, what I always recommend, no matter what, for anyone, is going to be collagen stimulators and skin tightening treatments. And the reason for this is because, like we talked about with what changes we're going to see in our face as we lose weight, we're going to see hollowing, we're going to see changes in elasticity. So I love to get ahead of this, you guys. We can be preventative when it comes to losing weight and seeing these changes in our face by doing procedures to tighten our skin as we lose weight. So in my practice, I do a lot of Ozempic, tirzepatide, we do body contouring, we do everything. So every single one of my patients that's on Ozempic, I tell them, hey, I'm going to recommend that we do some skin tightening treatments. I'm going to recommend that we do some Sculptra. Then when we get closer to your weight loss goal, we will talk about dermal fillers, enhancing your face so you feel snatched and ready to go. So what are those skin tightening treatments and what are those collagen stimulators that I'm talking about? So let's start with skin tightening treatments. Skin tightening treatments that I'm going to recommend as we lose weight are going to be Morpheus skin tightening and Cool Peel or CO2 laser. Now, Morpheus is just my go-to procedure and device for skin tightening. I get amazing results in practice. How it works is it is going to use radio frequency, and radio frequency is like heat, and it is also going to use needles, so microneedles. It is RF microneedling, and these needles needles, unlike traditional microneedling, which is just causing physical injury to the skin to stimulate collagen, these needles are going to penetrate deep into the skin layers, and it's going to allow that radio frequency, that heat, to go in and out of the tissue. So Morpheus is a bipolar radio frequency device, meaning radio frequency, heat, collagen is going to go in and out. And because of this, you're going to see a tissue coagulation or skin tightening effect. And this looks very, very amazing. I do it. Literally, I'm addicted to Morpheus, you guys. I do this treatment once every 6 months. I've done so many Morpheus skin tightening treatments. It is so, so good for your face, not only in general for aging, but especially if you lose weight. So that way, as you lose this fat, you're getting collagen stimulation in your skin. You're experiencing skin tightening, so you're not going to see dramatic changes in your skin elasticity. Now, the other treatment that I talked about was Cool Peel. And what's the difference? Well, Cool Peel is a superficial laser. So superficial laser meaning it's not using needles to penetrate deep in your skin for skin tightening. Instead, it is focusing on resurfacing the skin. So this laser is going to literally just take off the first layer of your skin, and then you are going to stimulate collagen. It helps with pores, fine lines, wrinkles, texture changes. You do get a skin tightening effect, not as much as you do with Morpheus in my opinion, but you do get a skin tightening effect. So I love both of these procedures. I'm ultimately going to recommend Morpheus when it comes to tightening your skin. But if you are somebody that's like, well, you know what, I need a little bit of skin tightening, but my main concern is skin texture. And as I lose weight, I want to continue to maintain good skin elasticity. Both of these treatment options are going to be absolutely amazing for you. Now, I can't talk about Morpheus or Cool Peel, any type of laser in general, without talking about the myths and fear mongering surrounding these procedures, because I get so many people coming into my practice and they're like, I saw on TikTok, Morpheus melted all the fat in my face. And this is something that can happen. I'm not saying this can't happen. Morpheus can melt fat, but it can only melt fat at certain depths. So this is why choosing a provider that understands facial anatomy, that understands how your skin is reacting and responding during treatment is so, so important. So when we are focusing on skin tightening, we are not penetrating deep enough into your skin to melt your fat. And I'm telling you guys, I get Morpheus all of the time. You can look at my face right now if you're watching on YouTube, and you can see my face looks totally fine. I don't have any skin laxity issues. I do Morpheus to improve my skin tightening. I get fillers, I get Sculptra, I get Botox, I get all of these things, and it doesn't impact my treatment outcomes whatsoever. In fact, it makes it better. It actually makes me need less filler. So they really, really work well together. So with weight loss, I definitely recommend skin tightening. Now, Cool Peel, again, super great, superficial laser. You will get a mild skin tightening effect. So I think deciding between the two is really going to depend on how much weight you're losing and how much skin laxity or volume in your face that you have to start with. So let's say you're within that like 10, 20 pound weight loss goal, then we can consider a Cool Peel if we're focusing on mild skin tightening. But if you are focusing on losing more than 20 pounds and you need significant skin tightening, if you are older than 30, so this is again something that impacts our collagen and elasticity in general, because as we age, we lose collagen, we lose skin elasticity, then I'm going to recommend a Morpheus. So come in for a consultation and you can see which one is going to be best for you, but definitely consider skin tightening when you're losing weight, no matter what. In general, I recommend doing a skin tightening procedure just because it's freaking amazing. But if you are losing weight, definitely do skin tightening. Now, how many treatments do you need? What is timing surrounding this procedure? And timing is going to be immediately. Like as soon as you can start skin tightening, start skin tightening. It is not going to impact your weight loss whatsoever. It's in fact going to help your skin stay healthy, bouncy, and tight as you lose weight. So as soon as you can get in for skin tightening treatment, definitely do that. The next thing I want to talk about is how many treatments that you're going to need. And this is going to be really dependent on the quality of your skin. On average, everybody needs a series of 3 treatments, and that's just to get best possible outcomes. And the treatments are spaced out 4 to 6 weeks apart. So you would do a Morpheus or a Cool Peel, and then you would come back to clinic 4 to 6 weeks later. You would do another one. You would come back to clinic 4 to 6 weeks later. You would do another one, and then you would do maintenance once every 6 months. Now, again, every single treatment is customizable based on your weight loss goals, based on the quality of your skin, all of these things, your age, there's so many factors that go into how many treatments that you will need. Maybe you're just going to need one treatment, and I'm going to recommend that you do one treatment every 6 months. So it's really dependent on what your skin quality is, what your goals are, how old you are, and how much fat that you have in your face that could impact changes in your skin elasticity. On average, I'm going to recommend 3 treatments for every single person. But again, this is really dependent on all of the factors that I just mentioned. Since we are talking about face and body, I want to mention when you are losing weight and you have these changes in your body, there are things that you can do as well for prevention. And one of my favorite treatments is called Evolve. Evolve is electrical muscle stimulation. So it is this device that uses radio frequency, which we just talked about. So think about Morpheus without the needles, plus electrical muscle stimulation. And it is going to do like 30,000 crunches at once while simultaneously melting fat and tightening your skin. So this is the ultimate biohacking tip and something that I do in my practice, you guys. Every single person that is on a weight loss medication does a series of Evolve. It's just built into their package. It's like my non-negotiable because as we lose weight, we're going to see changes in our skin, on our body. This is going to be very preventative. And the really cool part, since we are all about prevention and biohacking at Perfect Dose, is that when you do this, you are building muscle. And when you're building muscle, you're going to be less likely to put on more fat. So it's going to help you prevent weight gain when you are off of these medications, which is really freaking awesome. And in general, a fun fact that I learned is we lose our muscle with age 8% every single year. So in general, no matter who you are going to lose 8% of your muscle mass a year, and you can just speed that up if you're doing weight loss medications. So for example, I think there is a study out there right now that showed that patients on Ozempic were losing up to 40% of their lean muscle mass. So if you see people walking around, they're on Ozempic, they're not eating protein, they're not lifting weights, they're not doing something like Evolve for muscle stimulation and for skin tightening, and you see them looking super skinny, they're in their skinny era, well, guess what? They're not putting on muscle. They're losing muscle rapidly. This not only can lead to long-term health outcomes like osteoporosis, way higher risk of having osteoporosis if you don't have muscle, but it also can make you more likely to gain weight back after you're off these medications. So that's why I put every single person on Evolve in my practice that's doing weight loss. And if you're listening right now and in general, you want to be on it and preventative, and maybe you're not on weight loss medication, but you're losing weight, or maybe you're just listening and you're like, you know what? I just want to prevent muscle loss. This treatment is absolutely amazing. You physically cannot exercise this amount in the gym. You can't do 30,000 crunches. It's not physically possible. The device is absolutely amazing. It doesn't hurt. There's no downtime. It does take a little bit of time. That's the only downside to this procedure is you have to be in the office for about an hour because you're going to sit with this device on your stomach, on your legs, wherever you put it. And you're going to let it work for 45 minutes. And then you have to take in some time for cleanup, getting you set up, checking your weight, all of the things. But this is an absolutely amazing treatment. 10 out of 10 recommend doing something for muscle stimulation as we age and especially as we lose weight. So next thing I want to talk about is biostimulators, because if you are losing weight and you are like, okay, skin tightening, got it. Body tightening, got it. What can I do in addition to that? What about the volume in my face? Because I talked about how we're going to lose volume in our face as we lose weight. And the answer is biostimulators. And why I love this is because as we lose weight, filler can be metabolized and our face is going to change. So depending on how much weight loss you are going to experience, we may wait on doing dermal fillers until you're closer to your weight loss goal. But when we're talking biostimulators are going to force your body to stimulate its own natural collagen. And collagen makes our skin firm, bouncy, tight, and elastic. And Sculptra, which is my favorite biostimulator, is actually going to give your skin 1 to 2 millimeters of thickness with every single treatment. So you are going to be restoring volume in general that you're losing with age, but especially as you lose weight, you're going to be restoring volume as you lose weight. So instead of feeling like, oh my gosh, I look super hollow and sunken in, that Sculptra is going to be working as you lose weight to stimulate collagen, tighten your skin, increase your skin thickness so that you don't look hollow as you lose weight. It is an absolute game changer. I'm going to show you guys a before and after. If you are listening right now, head to my YouTube channel so you can see this. This is my patient. all that we do for her is we do Dysport treatments for her forehead, frown lines, and around her eyes. And we also do Sculptra because she was on tirzepatide, and on tirzepatide, she was worried about doing dermal fillers until she was closer to her weight loss goal. She wanted to lose over 20 pounds. And look at this change. Her face looks freaking snatched. She looks lifted. She looks tight. And this is because we were preventative with her weight loss by treating with Sculptra. So her treatment plan consisted of 2 Sculptra treatments. We did 2 vials each treatment. I recommend doing 2 vials standard. 1 vial is simply not enough unless you're 20 and you're just doing it for prevention. But if you're doing this for prevention with weight loss, you need 2 vials. Most likely you will need multiple treatments. And then what we're going to do is we're going to do a Sculptra treatment annually for her. We may do another one closer to that 6-month mark, just depending on how her weight loss is looking. So I always tell my patient, we're going to monitor your symptoms. So I'm going to see you back in 6 months. If you're still looking super, super great, I don't notice any changes in your skin due to your weight loss, then we'll keep waiting and do your Sculptra at your 1-year mark. But if we start noticing some of those changes, because again, she was losing more than 20 pounds, then we're going to consider another Sculptra treatment just so we can stay on it and make sure that she's not losing volume in her face. That's going to make her look older and more tired. Okay, so the next thing I'm going to talk to you guys about, now that we know skin tightening treatments, 10 out of 10 recommend, including body with electrical muscle stimulation. We also talked about biostimulators and why they are freaking amazing for your face. I love Sculptra. Sculptra is my go-to. There's another biostimulator that I am using, but I love it more for body areas, and it's called Hyperdilute Radiesse. And Hyperdilute Radiesse is going to be very similar to Sculptra in that it stimulates collagen. However, it is also a dermal filler. And what we do is we dilute it down. So we water it down, for lack of better words, with either saline or my favorite is PRP, platelet rich plasma. And that's when we draw your blood, we spin it down in a centrifuge, and we separate your liquid gold, your plasma, and that's your platelet rich plasma, from your red blood cells. And your platelet-rich plasma has your growth factors, your proteins, everything that's going to help with skin elasticity and collagen stimulation. So I love to mix my Radiesse with PRP. It looks freaking amazing. And I do treatments in the neck and chest with this product. Now, why do I like Sculptra for the face? Why do I like Hyperdilute Radiesse for the body? Well, Sculptra is going to stimulate more collagen. So I feel like it can be almost too much of a good thing sometimes for neck and chest. So how do you choose between Sculptra and Hyperdilute Radiesse when it comes to the body? Well, my preference, and again, everybody does this different, you guys, it's just my opinion. I love Sculptra for the face because it stimulates 60% collagen. It's amazing. I know I'm going to get absolutely amazing outcomes with Sculptra in the face. Now, it does take multiple treatments. It takes longer to see results because we don't lose collagen overnight, so we're not going to gain it overnight. And I like Hyperdilute Radiesse for the body because you get a little bit of that instant result. And that's because it is traditionally a collagen stimulating filler that we are diluting down with saline or PRF to make it smoother, to make it softer, to make it more spreadable. So it doesn't do all of the filling. So I like it for the neck and the chest because you get that filler effect of instant volume and then long-term of collagen stimulation. So that's just my preference. I could change my mind. You guys, I am changing techniques literally all the time. If you're going to an injector and they are not changing their technique often as trends develop, as new technology comes out, as we learn new things about facial aging, anatomy, and product rheology, you need to run. I tell my patients, I've been treating you since 2017, literally forever, but my technique then is different than it is now, and it will continue to evolve and change. So super, super important, you guys, that you are going to somebody that is considering all of these things, that's talking to you about these things. If you're getting weight loss medication somewhere and they have not talked to you about skin tightening for your body, they haven't talked to you about muscle loss, so making sure that you do electrical muscle stimulation, that you're eating enough protein, that you're lifting weights, you are not getting treated holistically and comprehensively. So I recommend going to someone that is taking this holistic approach because it all matters. It all ties together. And as we age, we want to look natural and we want long-term results. I care about what my patients look like 10 years from now, not just today. So I can't end this episode without talking about at-home treatments for everybody listening that maybe you're like, you know what, I don't have access to get into an aesthetic clinic right now. What can I do at home as I lose weight? And At home, as you lose weight, what I'm going to recommend is eating high protein. We need to eat high protein. That's going to help us keep our muscle. That's going to help us build muscle. It's also going to help us keep full longer, so that way we're not starving ourselves. If you're starving yourselves because you're losing weight and you're not eating enough protein, you will gain it back. Protein is good. So definitely eat enough protein. I recommend 100 grams or more a day, just depending on if you're male versus female. If you're male, that number is going to be a lot higher. For females, aiming for around 100 grams. I'm not super strict on this, but just aim for it is going to be ideal. The next thing you can do at home is making sure that you're adequately hydrated. Hydration impacts how our skin looks and feels. The more hydrated we are, the better our skin looks and feels. We lose hydration in our skin over time, just with age and lifestyle factors, environmental factors. So drinking enough water is so important. It's literally free. It's the easiest thing that you can do. The next thing I'm going to recommend is doing some skincare that focuses on maintaining skin tightening. So for body, I recommend Fermentone. Fermentone is one of my favorite treatments for the body. It's by Skin Medica. And actually, in Allure magazine, it was rated #1 for skin tightening. I'm going to show you guys. If you're watching on YouTube, you can see the ratings right here. These were the top treatments that were recommended. So Allure magazine says #1, and I freaking love this treatment. I put it all over my body. I also love doing retinol or bakuchiol, depending on the time of year. In the winter, I'll choose a retinol. In the summer, because I'm out in the sun more, I choose a bakuchiol. But this treatment for body, next level. It's going to stimulate collagen, increase cell turnover. I love to use Perfect Dose RX, and that is my skincare line. It is clean. All the ingredients are listed on the bottle, so you know exactly what you're putting on your face and on your body. And this treatment is going to help stimulate collagen. It's also going to help produce cell turnover, so new, fresh baby skin. It's under $100, so I recommend using it for your face and your neck. There is another product called Alpharet by Skin Better that is specifically for your body. So if you're like, I want to get something specific for my body only, stick to Fermentone and Alpharet. But if you're a biohacker and you're like, I want something for my body and my face because it's more cost effective and I'm not someone that's going to do a million steps in my routine, then get a Perfect Dose RX, retinol, or bakuchiol because you can use it on your face and your body. The next thing that I'm going to recommend for skin at home is going to be SPF, you guys. It's the easiest thing to do. You need to put sunscreen on your face every single day. UV is going to add age to our skin. It's going to damage our skin. It's going to make us look older, more wrinkly. It's going to prevent our skin from staying supple and healthy. So put some sunscreen all over your face, all over your body every single day. It is a non-negotiable. And the last at-home product that I'm going to recommend is going to be TNS for your face. TNS is amazing. It is actually indicated for skin sagging. So doing something that's going to help prevent skin sagging at home as you lose weight is going to be next level. If you are an injector, medical provider, and you want to learn more about my tips, techniques, how I operate in my practice, find me on Patreon at The Perfect Dose. If you're listening right now and you're like, I need to see before and afters, I want more education, my platform on Instagram and TikTok is at The Perfect Dose. I provide content to educate, inform, and entertain you. Thanks for tuning in. I will see you guys next week.